Nurse brain and clinical judgment. Clinical judgment is one of the most important abilities nurses develop throughout their careers. It involves recognizing relevant information, interpreting its significance, determining priorities, deciding what action is appropriate, and evaluating the results. Nurse brain encompasses this process, but extends beyond any single clinical decision. It includes the accumulated understanding that helps a nurse know where to focus attention in the first place. A new nurse may assess every part of a situation with equal intensity because everything feels important. An experienced nurse begins to recognize where the greatest risk may lie. This does not mean experienced nurses skip assessment. It means their experience helps them direct their attention. They know when a small change deserves a closer look. They know when a patient's response does not fit the expected course. They know when a routine situation has become something else. They know when to continue monitoring and when to escalate. They know when to ask another nurse for another perspective. They know when they need more information before making a decision. Clinical judgment becomes more effective when it is supported by experience, and experience becomes more valuable when it is examined through clinical judgment. Experience is not enough. It is tempting to believe that nurse brain develops automatically with time. If that were true, every nurse who remained in practice for a long period would necessarily become an expert. Nursing experience does not work that way. Experience provides opportunities for learning, but the nurse must recognize those opportunities. A nurse can experience the same situation repeatedly without examining why it happened or what could have been recognized sooner. Another nurse may encounter a situation once and spend considerable time thinking about what happened, what was missed, what worked, what failed, and what should be done differently the next time. The second nurse is deliberately converting experience into knowledge. This is one reason reflection is so important to professional development. After an event, the nurse can ask what was noticed, what was overlooked, what assumptions were made, what information was available, what information was missing, what happened afterward, and what the experience can teach. The purpose is not to criticize every decision made in hindsight. Clinical decisions are often made with incomplete information. The purpose is to develop a more accurate understanding of future situations. Experience becomes wisdom when it is examined. The seasoned nurse. A seasoned nurse isn't simply an older nurse or a nurse who has accumulated a certain number of years. Seasoned nursing is characterized by a depth of understanding that develops through repeated exposure to patients, problems, uncertainty, outcomes, relationships, successes, mistakes, and change. The seasoned nurse has seen enough situations to understand that the obvious problem is not always the most important problem. The seasoned nurse understands that a patient's condition can change quickly. The seasoned nurse knows that communication can be as important as technical skill. The seasoned nurse understands that asking for help is not a weakness. The seasoned nurse recognizes that every patient is an individual and that a diagnosis does not completely describe a person. The seasoned nurse also understands the limits of personal knowledge and experience. Wisdom includes knowing when you do not know. This may be one of the most important characteristics of nurse brain. As knowledge and experience increase, confidence should not eliminate humility. Instead, greater knowledge often makes a nurse more aware of complexity.